When we look at prenatal care in Nebraska, first of all, we have to look at research. That is, there's just a plethora of research that shows the benefits of prenatal care, that shows how prenatal care and the behavior and habits of a mother affect the unborn baby. Even the behavior of mothers before they become pregnant affect the unborn baby. And so we ought to be able to make a very clear and quick argument on behalf of prenatal care. Some of those facts are that stress and nutrition have a significant effect on pregnancies and on birth outcomes. Prenatal care is a critical part of ensuring that babies have the best chance at life. And when we look at what prenatal care consists of, we know that it is, first and foremost, to identify risks to both mom and baby, treating problems that are identified, providing education. That package is what ensures the outcome for a healthy baby. And, as has been discussed already, prenatal care can have a bearing on the life of the mother as well. We know that it's a life and death matter for both baby and mom. And we know that babies who are born without having had prenatal care are 6 times more likely to die at birth and in early infancy. We know that additional risks caused by lack of prenatal care include low birth weight, mental and behavioral disabilities, chronic respiratory problems, deafness, blindness, and cerebral palsy. Nebraska had a long-standing history of providing prenatal care. Regardless of parental socioeconomic status, babies were believed to deserve the best possible start at life until March of 2010, when the policy changed and over 1,600 women lost prenatal care. Almost half of those were U.S. citizens, and about 850 were undocumented citizens. So when we look at the cost of losing prenatal care, we need to look at the cost to those individual babies, as well as the cost to the state of Nebraska. Nebraska was already, before this change, beginning to see an increase in low birth weight babies. Women without health insurance was also on the rise, and women without health insurance are obviously less likely to seek prenatal care. And in citing a few studies, we can see that women without prenatal care are 3 to 4 times more likely to die themselves. We have a rate of 12.6 per 100,000 live births, and Nebraska ranks 40th in the nation. As was discussed earlier, numbers are small enough that it's difficult to see the difference between rural and urban. And even though that number is small, Nebraska's ranking is often surprising to people. We also know that the number of women receiving prenatal care was gradually increasing between 2000, the number of women not receiving prenatal care was gradually increasing between 2003 and 2008. Infant mortality rates overall in Nebraska are 5.4. 103 babies in their first year of life died. But we know among certain risk populations that number is even higher. For African American babies, it is over 16.3. We know that prematurity is increasing. Again, between 1990 and 2006, that rate went from 8.5 to 12.5. And at greatest risk are African American children, children born to women younger than the age of 17 or older than 35, and children living in poverty. And if you're concerned about not knowing or memorizing all of these numbers, we will be handing out an issue brief from which these numbers were taken in our working group, but I'll also give you some website locations where you can go and pull that issue brief as well. So we've talked about the cost to the individual babies and to the moms, but the cost to Nebraska should be of equal or greater concern to us. In addition to a values-based decision that prenatal care is just the right thing to do, we should also look at cost. The cost of a complicated birth ranges between $20,000 and $400,000, compared to $6,400 for a normal delivery. A NICU stay is $1,000 to $2,500 per day. The CDC actually estimates savings of $14,755 for every low birth weight prevented. There's various studies. One in Missouri shows that for every dollar spent, you save $1.50. The Institute of Medicine found for every dollar spent, you save $3.38. California also did a study, particularly of immigrant women, and showed that immigrant women, the difference between immigrant women with and without prenatal care, left babies 4 times more likely to be delivered at low birth weight. And so Nebraska's current policy, as a result of this change last year, leaves children covered when born in families at 200% of poverty or less. So a family of 4 earning about $44,000, a little more than that, actually will be covered at the time of birth. But low-income mothers will only be covered at 185% of poverty or below, and that's again an income of about $40,000. So we've already differentiated from an income base between those who will be covered for prenatal care and those who will not. But in the rest of the change, we know that undocumented women will not be covered, and we know that there are other women who are documented but have been sanctioned in other public assistance programs who have now lost coverage as well. So in conclusion, Voices for Children recommends that Nebraska restore prenatal care across the board for Nebraska babies. We also recommend that Nebraska do this by submitting a state plan to establish a CHIP program for coverage of babies yet to be born. This is an administrative procedure that they could have chosen to exercise a year ago, and we are requesting that they step forward and do that now. And simultaneously, we would request that they increase our Kids Connection coverage for prenatal care for women up to 200% of poverty so that it matches the eligibility guideline that the children will be served under once they are born. Again, for more information, Voices for Children has these details on our website, but we have 2 other websites that I would really encourage you to visit. We've got some website cards that we will be passing out. All of this information, excuse me, is on a website called babiesbornhealthy.com. And on that website, we exercised a lot of advocacy effort during the attempt to restore prenatal care, and we will be reactivating that from time to time when there are policy decisions being made on behalf of Nebraska babies yet to be born. Additionally, as we look toward the election in November, Voices for Children has a website called Vote Kids Nebraska, and we would invite you to go to that website to learn more about your candidate for state legislature, to get yourself involved, share information with other voters, and prepare yourself to step into the voting booth on behalf of children in November. We are also sponsoring a candidate forum on October 13th at the TAC building at 6 o'clock, I believe. Is that right, Aubrey? 6:30, thank you. And Aubrey Mancuso, our Director of Opportunity at Work and Economic Policy, can give you more information on that. So thank you. And